So I'm Sarah, and I'm going to be talking to you today about antibiotics. So raise your hand if you're in this room and you've taken antibiotics at some point in your life. Now look around. If not everybody here today has taken them themselves, they most certainly know somebody who has, whether it's their family member, or their friend, or the person sitting next to them today. We're probably all familiar with common antibiotics, such as amoxicillin, that tastes like bubblegum that they might have given you to treat an ear infection as a child, or azithromycin, a Z-Pak, that they maybe gave you to treat your last bout of strep throat. Antibiotics have actually been around since the discovery of penicillin in the 1920s, and before that time, it was not particularly uncommon to die of an infection that stemmed from something as simple as a cut. We have really taken for granted the effect these drugs have had on our quality and longevity of life in treating bacterial infections. And in recent years, there has been this problem of a drastically increasing level of antibiotic resistance. These bacteria are beginning to fight back. They are starting to combat even our most aggressive treatments aimed at the most severe infections we face. And due to their rapid levels of reproduction, evolution is on their side, not ours. So in order for these drugs to be effective, they have to get into the cell first. And the mechanism by which they do this is they have to cross through these cell membranes of these bacteria. And we don't really understand how they get through the outer membrane of gram-negative bacteria. But I like to think of these membranes as a gatekeeper, deciding what can come in and what cannot. And once these molecules get in, then they are allowed to do their job. But now, simply getting inside the cell is not enough, because these bacteria have developed new mechanisms to eject our drugs once they've entered, so that they are unable to stay around long enough to do their job. If you look to the right, here are two examples of common antibiotics I mentioned earlier. We as humans think of these as atoms connected by a bunch of bonds. But this is not how a membrane is going to see these molecules. So it is our goal to put on our membrane goggles, if you will, and to look at these molecules instead as an ensemble of physiochemical characteristics, such as shape, size, charge, or polarity, to name a few. We will then use this information with the aid of computer simulations to develop a novel and informed approach to antibiotic drug design to help combat the bacterial infections of the future that might be faced by you, your family, your best friend, or the person sitting next to you today.